What are the typical symptoms of chronic exertional compartment syndrome? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. One of the more difficult problems that a running athlete, and especially people that just like to jog, face is a problem called chronic exertional compartment syndrome. And it can be really difficult and sometimes needs surgery to allow them to get back to training. It can be really challenging. So in today's Ask Dr. Geier video, we're going to talk about what it is in response to honestly a very typical question about the problem. Okay, Salam asks, "Hi Doc, I was wondering, have there been cases of chronic exertional compartment syndrome where the athlete hasn't experienced numbness and tingling as part of their symptoms? Thanks, this site has been very helpful." Well, thanks, Salam. I really appreciate that. What he's talking about, chronic exertional compartment syndrome, is usually a problem of the lower legs. Baseball pitchers can get it in their forearms, but we typically see it in running athletes in their legs. What happens is, for some reason, the muscles swell with activity, with exercise. Typically, this is only a problem during physical activity, like jogging, even though it can start to bother people with really fast walking if it's been going on a while. But what can happen is those muscles swell. Well, in our leg, we have these fascia, layers of tissue called fascia that separate the muscles and their nerves and blood vessels into different compartments. So when the muscles swell, they can swell to a certain extent, but at a certain point, the fascia limits the amount that the muscles can swell. And if the muscles swell past that point, the leg can basically feel like it's gonna pop. The leg gets swollen, it gets really tight, and obviously it's painful. That's usually the hallmark symptom and what comes on first. But what Salam's getting at is when you have that and you get a lot of swelling and a lot of tightness of the muscles within those compartments, that puts a lot of pressure on the nerves and blood vessels within those compartments. So you start to get numbness and tingling on top of your foot and in your ankle and in your toes. So that's a pretty classic symptom as well. But yes, it's absolutely possible to just have pain, to just have swelling of the leg, again, with running or with really fast walking, and not have numbness and tingling, especially early on. Now, if it persists for a long period of time, then yes, typically the numbness and tingling persist for a while. Now, he didn't really ask about treatments, but what we typically talk about, because physical therapy a lot of times doesn't make it significantly better, we do these pressure tests, and if that basically suggests a diagnosis of chronic exertional compartment syndrome, and somebody doesn't want to give up running or whatever the running activity is, a sport like soccer maybe, then we talk about surgery, where we go in and release the fascia, which then allows the muscles to swell with activity and not cause pressure on the blood vessels and nerves. Have you had chronic exertional compartment syndrome, and how did you get over it? How did the doctor diagnose you and then treat you? I would love to hear your thoughts, your experience. So below this video, share your experience. I would love to read it, and I know viewers from all over the world would love to read it as well. If you know somebody with chronic exertional compartment syndrome, please share this video so that basically the information can help them. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and prevention, subscribe to my YouTube channel. Click the box in the upper right corner of the page. I record a couple of these videos every single week, and I'll deliver those directly to you. Thank you so much for watching. I hope this video was helpful. I look forward to seeing you right here in our next Ask Dr. Geier video.